problem in one place has the possibility to spread globally. The implications are global in nature. It affects many developing countries, and they affect them in a way that at some points are even cruel. It wasn't intended to make the point that, oh, we have a change in direction and a change in priorities. It was about illustrating that it's our money, we decide, and you're it. 25 years ago, AIDS was a death sentence. If you had HIV infection and you happened to be born in a poor country, you were going to die because we couldn't afford the treatments. Today, we're able to make antiretrovirals available to the most remote village in Africa. PEPFAR is a major contributor to the Global AIDS program, and the Global AIDS response has depended on the Global Fund PEPFAR. This change that is occurring in terms of US global support for AIDS treatment, for AIDS programs, has huge repercussions. People are going to die. People are going to get to a point where they cannot access treatment, and we are going to see a reversal in the gains that we've achieved over many years. What we're going to see in the termination of this kind of support to poor countries is an immediate challenge, which is people losing jobs, programs struggling, closing down. Those are the immediate issues. But the true impact of these funding cuts will only be seen in the next 2, 3, 4 years. Let me give you one example. When AIDS treatment is difficult to access, and when patients stop taking their medication, what happens is that as they stop taking their medications, the virus itself is exposed to low levels of these drugs in their bloodstream, suboptimal levels. And what happens is that the virus develops resistance. And of course, to treat drug-resistant forms of the virus is very expensive and unaffordable. So it begins to exacerbate a problem that of unaffordability of treatment, and the funding cuts will now make it even more unaffordable because the viruses that are in circulation have drug resistance. So we will see many effects over the next several years, and those effects will be difficult to say, okay, this was due to funding cuts many years ago, but we know now that that is what's going to happen. As if it's not enough that the funding was cut. A key challenge in many of these developing countries is the investments in the infrastructure to collect the evidence, to collect the markers that tell us how we are progressing. We are seeing not just the programs involved being terminated, but now we're seeing the ability to measure the impact of those programs also being depleted. It's like a double whammy. CAPRISA is one of Africa's leading AIDS research centers. We undertake research that has assisted the world in defining what's the best way to treat patients with TB and HIV. We expect that by the end of July, we will have no US government funding. Who's the biggest losers? It's in fact the US public, because they are losing out on the research that we are undertaking that would enable them to better respond to the HIV epidemic in the US. So we are all losers in this equation. When faced with the current situation where there are threats being thrown all the time, that the temptation is to say, okay, I'm going to keep my head, below the parapet, so no one can see me, I'm not a target. That's a false supposition. That is a recipe for trouble. For me, I can't do that. It's not in my DNA, and I think for many people, it's not in their DNA. They believe in what is right, and they will stand up for what is right. And now is the time to do that.